Let's talk about henna fissure. Henna fissure is a laceration or a cut or a wound or ulceration of the superficial layer of the henna canal. When this happens, the person experiencing or having henna fissure will be having painful defecation. If they want to go to the bathroom, they want to do number two, they have painful defecation. They could sometimes have bleeding with defecation, or sometimes there is no blood. The pain is usually there. Sometimes this could be acute or chronic. Acute simply means it's happened within short period of time, while chronic means it's been happening for a long period of time. We have new diagnosed cases of anal fissure every year, and only in United States of America alone, we have over 250,000 new cases each year. Let's talk about the symptoms. I mentioned them earlier that there is painful defecation and there could be bleeding during defecation or there could be no bleeding. Let's talk about the causes. What will give you inner fissure? What will cause inner fissure? What will cause a tear, a laceration, a cut in your inner canal? Listen to this. With sexually transmitted diseases, you could have inner fissure. With constipation, you could have inner fissure. With chronic diarrhea, you could have inner fissure. With childbearing, you could have inner fissure. Anal cancer is another one. Anal sex is another one. Inflammatory bowel disease is another one that will give you inner fissure. Tuberculosis is another one. Let's talk about how you're going to confirm if you have inner fissure. You have to go to see your provider, go to the hospital. Then they're going to do physical examination. They're going to check that place on your anus. They're going to examine to see if it's really inner fissure, hemorrhoid, or something else. Go for medical checkup. If you have symptoms of painful defecation or whenever you poop, you're having blood in your feces. Okay, go for checkup. Now let's talk about the treatment. Frequent sit baths helps to relieve pain, promote healing, promote circulation, and also prevent infection. Frequent sit baths helps a lot. Another thing you could do to take care of inner fissure is make sure you eat high fiber diets. They prevent constipation. Another thing you could do to treat inner fissure is to make sure to prevent constipation. When you feel like going, yes, do not delay. Go and have that number two. Another thing to do is to make sure you drink adequate water. Always keep hydrated. That helps a lot as well. Another thing to do is to make sure that you use two softeners to prevent constipation as well. You don't want to have constipation that will cause progressive tear in your henna canal. And if all those fails or you have a chronic condition that refuses to go, yes, you could have a surgical intervention that we call lateral internal sphincterectomy. So you have this procedure done, and within 3-4 weeks, everything heals quickly. It depends if you don't have other secondary diagnosis, if you don't have other conditions that will prevent healing. This procedure is a standard treatment and has helped over 90% of the patients who underwent this procedure. Let me tell you this, if you don't go for treatment, if you do not treat your henna fissure, there are consequences that we call complications of henna fissure. One of them is bleeding. Another one is pain. You keep having pain because the problem is still there. Another one is infection. Open area, open skin, they are prone to infection. You could have fecal incontinence. Incontinence can happen, which simply means you might lose control of passing stool. If you have inner fissure that is left untreated, you are prone to have incontinence. Another problem or complication of untreated anal fissure is fistula. Fistula is the creation of hole or development of hole between two or more adjacent structures. If you have some pain in your anus or you bleed each time you defecate, make sure you check it out. Go to your doctor. It could be anal fissure or it could be something else. Make sure you find out, okay? See you again. Annual medical screening. What is annual medical screening? A lot of us, we don't go to the hospital unless we fall ill. If we don't get any big sickness that will tie us down for not doing our daily routines, we always refuse to go to the hospital. Now, you've been using your whole body for a whole 1 year. For a good 1 year, you've been using your body, and you still refuse to go to the hospital to get checked up. It's time for you to get checked up. Imagine you've been using your car for a complete 1 year without doing any maintenance work on it. Your body systems are working harder, even more than a car. So you need to get checked at least once a year. When you go to see your doctor, there are a series of things to get done to make sure you are okay. Now, they're going to check your muscle strength, they're going to check your reflexes, they're going to check your balance, okay? You might also need some blood screenings and urine tests. Also, based on your age, there could be some recommendation for cancer screening. Also, if there are immunization that you due for or that you have been missing in the past, at this time, they could review everything. When you go for your annual screening, the doctor will take his time to examine you from head to toe. There are some things you might not know or you've not been noticing is going on in your body, but a professional will point it out to you that, hey, mister, something is going wrong. And this is why you need someone to keep his or her eyes on you. Go do your medical screening. When you go to do your screening, at this time, there might be some things happening in your body that you're not aware of. But through annual screening, yes, these things could be detected early enough so you will get treated without causing major damage to your body. Mere using a stethoscope to listen to your heart could actually give a lot of information that you don't know. You might not be feeling the symptoms, but something is going on. From there, they will send you to go do EKG. From there, they will send you to go do echo. Or from there, they'll send you to go do some other investigations. You need to do annual medical screening. Take care of yourself and don't wait until your body breaks down. Okay? Will you go now? Make sure you go.